Hey everybody, Dr. Patel here. Welcome to my Facebook Live. For all you regulars, I am so sorry that we are so late today in doing this. We are way late. Shoot, we should have started this at 2 o'clock, so I apologize. We had a really busy day at the clinic today, but a great day. Helped a lot of people, and hopefully I'll be able to help you with some of the information we talk about today. Today we are continuing our discussion about the knee, and we're going to be talking about ACL tears. So last time we talked about knee anatomy. So if you want to get caught up, that video is available on my Facebook feed or on our, it will be available on our website as well, fxregencenter.com. Today I'm going to be going over ACL tears, and then I'm going to be going over next week osteoarthritis, as well as some other topics in the future related to the knee. Now, ACL tears. Now, if you recall from our discussion last week, the ACL is that strong ligament on the in the inside of the knee. When we look at this knee joint here, right? Just to recap, this is the thigh bone, the femur, the lower leg bones, the tibia, and its partner, the fibula. The kneecap sits here in the front. You have these ligaments on either side, which are the MCL, the medial collateral ligament, and the LCL, the lateral collateral ligament. These are the ligaments that are in charge of stability for side-to-side motions. Then you have the deeper ligaments, your ACL and the PCL behind it. The ACL here, this is a strong, thick ligament that is in charge of stability in various different directions, including front to back stability, including some stability in twisting, and including stability in going with your knee going inwards. That ACL with all ligaments, right? Just to recap again our discussion about ligaments. The ligaments are those thick rubber bands, like those ones that surround broccoli in the grocery store, right? So there's a little bit of a stretch to them, but otherwise they're strong supportive structures. Now, that ACL ligament can get torn in various different ways. And you might be familiar with that ligament getting torn in folks like basketball players, football players, soccer players, athletes that have various different injuries. One of the common things that we think about when people have those injuries are things like when you're a football player and you get tackled and then all of a sudden you're limping off of the field, or you have some instability, and you find out that people had an ACL tear. So this I'll show you is an example of what we typically think about when we have an ACL tear, right? This is a football player that was tackled. That knee gets tackled inwards, right? Get pushed inward, and you come out of that with an ACL tear. But in actuality, we see that ACL tear occur very commonly, even in non-contact injuries. So what do I mean by a non-contact injury? I mean that we are moving, and there's nobody around us, there's nobody tackling us or anything along those lines, and then the knee gives out, and we suddenly feel some pain, and afterwards you end up getting a bunch of swelling. The pain could actually subside, the pain could actually decrease, but we're left with that instability or buckling sensation, and that oftentimes is an ACL tear. Now, if you're watching football, if you're watching basketball, or whatever, and at any point, if you see nobody else around the player, and they're moving, and you see that their knee kind of goes inwards like this, like we're showing in this image here, and they suddenly fall to the ground. And if they are limping, or they're on the ground for a period of time, then for all intents and purposes, that's an ACL tear until proven otherwise. And it's that common that that type of motion can cause it. So why is that? So when you look at the ACL, when your knee goes inwards in this direction, that ACL really is getting stretched. So I'm going to see if I can kind of show what that looks like with a drawing here. So here's your, oh, excuse me, here's your knee here. Oh, hold on. I've lost visual, guys. Technical difficulties, I apologize. There we go. So, oh, my pen's not working. Well, that's not fun. Well, I'm going to draw more freehand here. This is your femur. Freehand, I mean I'm drawing with my mouse, so it's going to be a lot uglier than when I usually draw. Here's your femur. Here's your tibia on the bottom and your fibula, and here's your ACL that goes across. Okay. And when your body moves in this direction here, when your knee bends in that direction, what happens is that ACL gets stretched. So I'll show you what I mean, like so, right? When your knee bows inwards or goes into a knock-kneed position, your ACL gets stretched. There's other injuries that can take place during this time too. So one of those injuries is that your MCL, which is the ligament that connects this side, you can see that that ligament ends up getting stretched as well. So that actually can get an injury. And then finally, your medial meniscus, which sits right here, which is the shock absorber, this meniscus actually has fibers that are intimately connected with the MCL. So when that MCL suddenly stretches, then that meniscus gets stretched along with it, and that can get a tear also. Finally, if this is an injury when the knee is going inwards in this direction and there's also twisting involved, well, that's a situation that even the lateral meniscus over here can get injured, because that lateral meniscus ends up being squeezed in this area, and a twisting motion can cause a tear to occur. So there's several different injuries that can occur even in the setting of an ACL tear. So the question is, when is the ACL tear the issue? When is there something else going on that's a part of the picture? So, wow, that is a horrible drawing. I apologize. But I hope that gets across. I wish my pen here was working, but I got to get this fixed apparently. But I hope this message gets across that there's a lot of different things that could occur in the setting of an injury that could cause an ACL tear. And the ACL tear may not necessarily be the primary issue at hand. So what do I mean by that? You get an injury like this, your knee swells up, you're having pain. If you're having pain on one side or the other of your knee, and that's your main issue, and you're not having any significant instability issues, your knee's not buckling, it's not giving out from underneath you, it's not feeling loosey-goosey, then regardless of if your MRI shows that you have an ACL tear or not, your symptoms that you're complaining about may not actually be associated with that ACL tear. An ACL tear, especially if you're getting older, an ACL tear may be something degenerative that's taken place years ago, or has taken place gradually over time, and might not be a factor whatsoever in your picture at this juncture. So just because your MRI shows that you have an ACL tear does not mean that that's the thing that we need to worry about. So if you had an ACL tear occur during an injury, but your primary symptom is pain, and you're not necessarily having any instability or weakness, then that ACL tear may or may not need to be treated. Okay? But the opposite scenario, if you have an injury, swelling takes place, etc., And now you're not having that much pain. You have a little achiness here or there or whatnot, but the main symptoms that you're having is instability, is looseness of the joint, is buckling. You're going up or down stairs and your knee feels like it's going to give out from underneath you, or you're doing some side-to-side movements and you're feeling unstable when you're moving, then that's a situation where your ACL might be the issue. So when you have an ACL tear, then, well, what are your treatment options? What are the things that you need to consider? Before we get into that, I'm going to show you just a couple examples of an ACL tear on an MRI. So I'll show you here an example of what an ACL tear looks like. I'm going to go away from my beautiful picture that I sent. I apologize. I know you guys were loving it. But, oops. So here is a side view MRI of a knee. And when we look at this, and this is the femur, this is the kneecap, this is the tibia or the lower leg bone. This is the patellar tendon or ligament that connects the kneecap to the tibia, and it continues on as the quadriceps tendon that goes to the quad muscles, which are thigh muscles. And see how that's nice and black throughout here? Black is what a nice healthy tendon or ligament structure should be colored as. And I'll show you what a nice ACL looks like on MRI. Here's an example of a healthy ACL. You can see here that this ACL is thick, black. It connects the thigh bone, the femur, all the way down to the tibia. That's what a nice healthy ACL should look like. Okay. Now you can see in this picture here that we have this black fibers of the ACL here, and we have some hazy fibers going in this direction, but it's clearly not as pretty as the other one was. It's grayer in appearance, and there's this white area here and some white smudgy stuff throughout here that could be at the very least suggestive of a sprain of the ACL, or at the very most even some tearing of the ACL as well. So that's kind of what an ACL tear looks like. There's various different types of ACL tears. There's situations where the ACL looks like it's completely blown away. So there's situations that look like this, where your ACL, you hardly see all of it. You see little faint fibers here and there, but you really don't see much of it at all. And then there's a lot of different varieties of what happens when your ACL is torn. Now, when is it appropriate to get what type of treatment? When you think about ACL tear, the most common treatment that we think about is an ACL surgery. And you know, it's beyond the scope of today's talk to talk about the different types of ACL surgeries, you know, cadaver graft versus patellar tendon versus quadriceps tendon, etc. What are the appropriate types of surgeries to get? For today's talk, I want to talk about, you know, is surgery important? Is surgery necessary? Or can surgery be avoided? First and foremost, I want to talk about when surgery should be done. Now, when you have an ACL tear that occurs, and if it's a full thickness tear, when the fibers are torn and separated, or they're torn and those pieces of the ACL are cockeyed, they're going in different directions, they're flapping in the wind, well, that's a circumstance where that ACL tear is more severe, and that's a situation where the ACL won't necessarily heal on its own or without a surgical intervention. Now, if that situation is also accompanied by significant instability, then that's a circumstance where surgery may be a very, very reasonable thing to do. There's a caveat to that statement. There are patients that I've seen that have completely disintegrated ACLs that are actually professional athletes and are able to perform at a higher level and actually have no issues associated with instability. Why is that? Because even though the ACL is very, very important, we have a slew of other ligaments that are involved with stability of the knee, and if those ligaments are strong and if our muscles are strong, well then we don't necessarily absolutely need the ACL. And if you're able to maintain stability without it, then a surgery is not always necessary. But if you are a professional athlete, or if you are very, very active, if your life revolves around X, Y, and Z sport or activity, or even if you have significant instability that's getting in the way of normal activities like walking or going up or down stairs, then an ACL surgery may be very reasonable. This is particularly true for younger patients, because younger patients, if you have significant instability and a completely torn ACL, then getting that stability back may be a determining factor as to how bad your knee progresses in terms of things like arthritis. That being said, an ACL tear surgery does not prevent the need for arthritis. In fact, there's studies that show that after an ACL tear surgery, you still get arthritis when you get older in that knee, and potentially even worse than if you didn't have the surgery if your knee was stable. So there's those factors to consider in regards to the surgery. Now, generally speaking, if you're older, then generally speaking, surgery isn't the best idea for you, because an ACL tear surgery actually requires a long recovery. And as I mentioned, the ACL tear does not absolutely equate to instability. As we get older, our ligaments in general tend to tighten up. We develop some osteoarthritis changes, which eventually actually tighten up that joint. So having an ACL is not the determining factor of if your knee is or is not stable. So surgery is not always necessary. Again, when is it necessary? If you're a professional athlete, or if you're an older athlete that requires that fine, precise movements and absolute stability. And number two is, again, if that ACL tear is causing instability that's not allowing you to do the things that you want to do functionally in life. So I'm talking about if and when you should be doing surgery. So why is that even a question? Shouldn't you always get surgery? What are the alternatives? So what's interesting about this is there's actually been some studies that looked at the difference between getting an ACL surgery and not, right? Doing an ACL surgery versus things like physical therapy. And there was actually an interesting study that looked at, this was published in the New England Journal of Medicine back in 2010. It was a randomized controlled trial that looked at patients that had an ACL tear and either immediately went to surgery or waited for their surgery and had physical therapy first. What was interesting about this is that, number one, there wasn't a substantial difference in terms of outcomes in those that had the surgery sooner versus later. So the old school thought was you should get surgery as soon as possible, because otherwise you're going to be unstable and things are going to substantially worsen, which is probably true if you had the ACL tear and did absolutely nothing. But in this study, in people that had physical therapy first, that wasn't necessarily the case. And in fact, about 61% of patients that were just in the physical therapy arm of the study were actually able to avoid surgery altogether. They thought that they had enough benefit that they did not that it did not warrant going through surgery as the next step. 61% of patients actually avoided surgery with physical therapy first. And in the other patients that ended up going through surgery, no substantial decrease in their outcomes compared to those that had surgery first. So that's a very important statement. So unless you fall into that very narrow category of primarily young patients that are in high level, professional athletics. Unless you're in that population that an absolute treatment such as ACL surgery is more necessary, and we're looking in the short term, not the long term. Unless you fall into that category, it's potentially better for you to actually try physical therapy first, and 61% of those patients will be able to avoid surgery altogether. And if you end up getting surgery, then you're still going to have good outcomes in regards to that. So really, really important statement. There was another look at patients and looking at arthritis following patients over 5 years after ACL injuries. This was interesting. This was a paper that was in the British Journal of Sports Medicine in 2019, and it followed patients out 5 years that had either early or late surgery with ACL. What was interesting about this was those patients that had early surgery had nearly double the amount of arthritis compared to those patients that did physical therapy first and waited to have their surgery. Let me say that again. Comparing patients that had early surgery versus those that had physical therapy first and then surgery, those that had early surgery had double the risk of arthritis compared to those that waited. So when we think about when we should and should not do surgery, if we should and should not do surgery, it's not always necessary to jump to surgery first. My recommendation for most of my patients, again, that are not in that small category of professional athletes that have a timeline, that have a short window, a career, etc., that's dependent on it, outside of that window, it's my recommendation typically to actually do physical therapy first and to potentially do an orthobiologic treatment, which I'll talk about in a second, if they are a candidate for that, in order to try to prevent the necessity for surgery altogether, and potentially even provide stability, even provide healing in a shorter recovery time period overall. So really important takeaways from this is that ultimately we want to get the best outcomes long term, and one of the reasons why we would want to try to avoid the surgery is we know that arthritis does increase after surgery. In cases of instability, there's going to be arthritis no matter what. But after surgery, we know that increased arthritis occurs. What's interesting is there's a high rate of re-tear of ACLs after surgery. And what's interesting is there's actually some studies that show that there's a high rate of tear of the other knee's ACL after you've had surgery in one knee. But what can we do to help augment the recovery if we're trying to avoid surgery? Well, there's over the past several years now, the folks over at the Centeno Schultz Clinic developed a way of injecting directly into the ACL both bundles of the ACL using X-ray guidance, using a patient's own bone marrow cells. And we've been able to now published case series, published histological studies, and several patients that I've treated over the course of the last few years that we've been able to inject directly into their ACL tears and actually have healing of the ACL tears occur. So pretty profound stuff that we've seen over the last few years, and really important fact that we can actually, within certain parameters, we can actually heal some ACL tears. And so if we are going to try to avoid surgery and we're going to be trying the physical therapy route, then, and if you are a candidate for a bone marrow cellular treatment, this is something that can really be beneficial at actually healing that ACL without surgery. And I'll show you an example of that right here. So let me see if I can do this here. This was a patient of mine that had an ACL tear here. Let's see if I can zoom this in a little more. Whoa there. This patient had a full thickness tear in the middle of their ACL. You can see this black line is their ACL, this white gap is the full thickness tear, as was read by their radiologist. And we did a stem cell treatment directly into the ACL. And you could see that afterwards, we ended up getting substantial healing. That ACL was completely intact. That gap in there was gone. I'll show you another example here. Let's see here. Of another ACL that was actually a poor candidate based off of our measurements. This was a patient that had a partial thickness tear. This is just a drawing of what an ACL looks like. This is the ACL here, and you can see some haziness throughout it here and some white gap right there. So it was partially torn. There were still fibers that were intact, but because of the tearing, the shifting of the bone was substantial, which made them a poor candidate for this ACL procedure that we do. And I injected into the ACL with the patient's own bone marrow, and we ended up getting, so this was before, we ended up getting some decent healing, but there was still some signal in here. There was still some haziness, so it looked like a sprain type picture. So I actually injected it again using the patient's own blood PRP, and we ended up with kind of a pristine, beautiful looking ACL afterwards. The patient had significant improvement in their stability and strength after the procedure. So those are just two examples, and we have several. If you go onto my Instagram at Regen Dr. Patel, REGENDRPATEL, and we scroll back quite a bit, we could actually see a bunch of ACL tears that I've treated. You can see what the injections look like under x-ray guidance. You can see a bunch of before and afters. If you go to our website, fxregencenter.com, fxregencenter.com. You can see in our section that's labeled areas treated knee ACL, you could actually see one of our patients, her testimonial, a young competitive cheerleader who had a full thickness ACL tear that had significant healing, and she was able to return back to a high level of cheerleading as well. So take a look at these things. The reality is that sometimes ACL tear surgery is absolutely necessary, but there are a lot of circumstances where we can avoid it. And really outside of a small window or small category of patients where it's absolutely necessary, doing the appropriate physical therapy, exercise, and doing the appropriate biologic therapies that we provide, we're actually able to get some pretty fantastic results overall. So if you do have an ACL tear, or if you were told that you have an ACL tear and you need surgery, it's definitely something that you want to just take a step back and make sure you do your homework. The recovery for ACL surgery can be long, can be extensive, although there are some folks that return to high levels of activity in sport even within a year. There's some studies, there was a study on professional soccer players, for example, that showed that a chunk of patients did not return to pre-injury levels of activity even at the 2-year mark. So really something important to consider. I think that if you're considering surgery for the ACL, even if you do have a full thickness tears, because some full thickness tears are still candidates for a stem cell treatment, you should always consider getting a second opinion. Again, unless you fall into that little window of category where your career, your job, your livelihood depends on your ACL, it might be a little bit of a different topic. Shoot, even then it might be worth it to get a second opinion. So I hope all that made sense. A lot of stuff to unravel in a small period of time. The ACL is complex. There's a lot more that I could have discussed. If you have any particular questions about the anatomy, about types of injuries, about things that can cause injury, right? things like ankle and foot problems, things like hip problems or nerve irritation in the low back. Believe it or not, all of those type of things can actually lead to an ACL injury. So if you have questions, concerns, thoughts, please comment, please drop me a DM, or you can always email us at info@fxregencenter.com. A lot of resources, a lot of stuff available on my website, so if you want to scurry over there and take a look, there's a lot of information there about ACL tears. Hope you enjoyed it. I hope you guys have a great weekend. I apologize again about being late for my Facebook Live, and I hope to see you next week. Until next time.